5 minutes, Mayor, 5 minutes.
I'm sorry. All right. Today is, welcome to our work session, Las Cruces City Council. Today is Monday, March 27th, 2023. It's approximately 1 p.m. If you please join me in the Pledge of Allegiance, please.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, so we always start off our meetings with the introduction of our pets of the week. And Amy DeFelix, who's joining us via Zoom. Are you there, Amy? Yeah.
Hello, yes I am, I'm here.
Okay. We'll let you take it away.
Awesome, let me share the screen. Alrighty, so for our cat of the week, his name is Greg. His animal number is 60165. And he has to say, I'm a handsome and unique boy. One thing you might notice about me is that I'm missing a tail, which you can't really tell in his pictures, but the next thing you might notice is how much I absolutely love pets and how 100% melt in your hands during a good neck scritch. I'm not the biggest fan of other cats. I want all the attention to be on me. I promise I have as much love to give as a household full of cats. And then we have our dog of the week. Her name is Jade, and her number is 54255. And she has to say, I'm a great companion. I already know sit and down, and I'm very attentive to my humans. I take treats very gently too, so help me learn some new commands. I do enjoy nice casual walks, but I will sometimes get a little excited to pull on the leash. I'm an affectionate girl who would be great in almost any type of home, as long as it's full of love and affection. We do have an adoption event this Saturday. We'll be there Saturday, April 1st. We will be at the Downtown Farmers and Crafts Market. We'll be there from 10 a.m. to 1 p.m. And we're always stationed out by the Organ Mountain Outfitters store. So just come along, peruse the farmers market, and say hi to some of the adoptable pets we'll have. And now, to also continue on with the spay and neuter theme that I've been doing this month, I'd like to share, I guess, some general info about just the spay and neuter cost effectiveness, because I know another reason why some people get a little deterred for spaying and neutering is because it's expensive at a private clinic. And it can be. Looking online, the general kind of price range that I was able to find would be anywhere between $150 to $400. And this price, it definitely varies between location, like between different vet clinics offer their own prices. Dogs and cats, prices will be different. Dog size classes, like a small breed, will be a different price than a medium or large breed. And a spay and a neuter also cost differently. So that's why there's this wide range. There's a bunch of different factors that go into the total cost of a spay or a neuter. But alternatively, I would also like to raise the general kind of estimation about the cost of raising a litter of puppies or kittens if you don't get your pets fixed. And that will probably range between like hundreds to thousands of dollars. And that's also dependent on vaccination costs where you go, the food cost, vet exam costs, and overall the litter size. So I know like the lower end that I've estimated would be about hundreds of dollars. Multiply that by 4 to 6 if you have a cat, because that's the average litter size. 5 to 6 for puppies, because that's the average litter size. And we've also seen cats here coming in with litters of like 10, 12 even. We've had, I remember very distinctly, a mama dog came in and she had 15 puppies. So that is very expensive, especially in comparison to just getting her spayed. Overall, that cost would have been greatly decreased. We do have one low-cost spay and neuter program that is available to the low-income communities here within Doñana County, and it is SNAP. You can visit their website, snapnewmexico.org. They do request a copay. It is only $50 per cat, no matter what, $75 per dog, no matter the size. That flat fee will help you take your pet to 8 different clinics within the Las Cruces area, and it definitely helps kind of offset the cost. But in general, spaying and neutering your animal is much less expensive than, in the long run, paying for raising a litter of puppies or kittens, which we do get a lot of litters surrendered to us specifically because they cannot afford the cost. And always, that's why we definitely suggest spay and neuter, because that whole situation would definitely be prevented if the parents were spayed or neutered beforehand. We would also, I would also like to say, our board of directors would like to announce in general that we as the ASCMV are a different entity with the dog park that is off of Rinconada as well. So we don't have any sort of say or control of what goes on there. I know we've been getting a lot of questions asking about when the dog park is going to be open, and we don't know because we don't have any sort of say in it. But I also would like to announce that I saw online that the Parks and Recreation Department did announce that that dog park will be open. Its grand opening will be tomorrow, Tuesday, March 28th. Just spread the news. I know people have been asking. We really want to check out that brand new fancy dog park, but it will be open to the public tomorrow. So I'm sharing the screen, and there we go. Thank you.
Okay, thank you, Amy. Appreciate all that information. Okay, next is going to be our Jobs of the Week, and Irene Pata from our Economic Development Department will share those jobs with us.
I'll let them set that up. In the meantime, Irene Potter with Economic Development. Good afternoon, Mayor, City Council. Unless they're letting me. Oh, okay. Oh, boy. I haven't had to open it from here before. Nope, those are meetings.
So go to work sessions to your right. Click on one
work sessions.
Yeah.
Got it. Okay.
And click
Thank you.
that, and then 27th.
There it is. Thank you, Mayor. Okay, so we begin with the City of Las Cruces, who is hiring for a community outreach manager. This position pays between $66,000 and $95,000 a year and closes on April 4th. White Sands Missile Range is hiring for a computer scientist. This position pays $53,000 a year and closes on March 31st. La Casa is hiring for an executive assistant. This position pays between $44,000 and $64,000 a year and closes on April 16th. Families and Youth is hiring for a communication and media coordinator. This position pays between $39,000 and $63,000 a year and closes on April 14th. El Paso Electric Company is hiring an engineer. This position pays between $66,000 and $90,000 a year, depending on experience, and closes on April 14th. And Angel Wings Home Care is hiring for a home care attendant. This position pays $12 an hour, depending on experience, and closes on April 14th. And for more information, you can contact our local Workforce Connection office at 575-524-6250, or visit them at their local office at 226 South Alameda, or online at employeen.com. Thank you.
Okay, thanks, Irene. Okay, so we've got 3 items on the agenda. The first one, we have a couple new programs that have come on board, the Project Light as well as 988, and Hugo Costa is here to talk to us about how that they interact and collaborate with 911. So Hugo's the director of our 911, or MRVDA, Mesilla Valley Regional Dispatch Authority.
Good afternoon, Hugo Costa, Executive Director, Mesilla Valley Regional Dispatch Authority. Good afternoon, Mr. Mayor, councilors, Mr. City Manager.
just a reminder, that mic, you have to always hold down, or you can use that other Mr. Microphone and leave that on permanently.
Okay, let's see how good I do with the holding it down. I have a brief presentation. I believe the counselors have received the packet with these slides, but I'd like to go over them here in public with you. First of all, just a little bit of data as to the number of behavioral health calls that are dispatched annually at MIRVDA. And we went back from 2018 to 2022 full years, and then for this year through February. And one thing I'd like you to notice, and it's probably a little bit noticeable in the next slide, is that the call volume has pretty much remained static. We haven't seen a significant decrease in the call volume for behavioral health, suicidal ideations, and suicidal calls, and we haven't really seen a large increase either. So it's remained a bit static, which I'll come back to that later in the presentation. We've been working with 988 since July of last year when 988 became implemented. However, we had been working for several years with the New Mexico Crisis Line on a protocol to transfer behavioral calls to them. The New Mexico Crisis Line then became the 988 Center for the state of New Mexico. So here's a protocol that we use. It's a very simple protocol. We put it in when we were working with New Mexico Crisis Line. We tweaked it a little bit for the 988. And this is what our dispatchers follow when a 911 call comes in. So the first thing is that when a 911 call is received, and the type code, and the type code is how we code calls in the computer-aided dispatch system. And that's what the responders are told that the type of call they're responding to. So the three type codes that we looked at are behavioral issues, suicidal subject, and suicidal attempt. And we perform emergency medical dispatch on all these types of calls. And what emergency medical dispatch is an interrogation, a series of questions that goes through a flow chart. And then determines what the proper response is. So as we're asking the questions, a few things that we're looking for are there any unusual or aggressive behaviors? Are there any weapons involved? Is there an attempted suicide? Is there an overdose? Is it a gunshot victim? Are there cutting injuries, or is there a jumping or attempt to jump? If the answer to any of these questions is yes, then the protocol is to automatically dispatch out the appropriate first responders, law enforcement, fire, or EMS. Can be any one of the three or all three together, depending on what the incident is. If the answer to those questions in the middle box is no, none of those are evident, then the call can be considered to be transferred over to New Mexico 988. And we leave a lot of that at the discretion of the dispatchers. A lot of them, veteran dispatchers, sometimes they can go on gut feelings, sometimes they can go on what they catch on the background of the call, some historical issues with either the caller or the address. So the human factor of the dispatcher discretion also comes into play. But this flow chart just very quickly shows you what we will not transfer to 988, and then all of the types are considered transferable to 988. So let me go briefly about the calls that we do not consider transfer to 988. It's important so that you know what the dispatcher is looking at. So and we've divided these into categories, and we're keeping statistical data on them. The first are dispatches requested by healthcare professionals. These types of calls fall into these categories: calls that are being transferred back to us or sent to us initially from 988. So for example, a caller could just bypass 911, call 988 directly, And then after speaking with the caller, 988 determines that a first responder intervention is needed. They will then transfer that call to MRVDA for dispatch. Sometimes we will transfer a call to 988 that we feel meets the criteria, and on some occasions, they'll, after talking to the caller, determine that a field response is needed, and they'll transfer it back. So those are those types of calls. Medical facility requests. Some of our mental health facilities, some of our local hospitals, if they have a patient with behavioral health issues and mental health issues, they may request a transfer to another facility. So they'll call 911 and request an ambulance. And then we get these requests from also mental health therapists, the Veterans Crisis Line, private mental health practitioners, that there will be a patient with them in their office, or they'll be having contact with them via telephone, and they'll determine that this person needs an intervention and needs transport to a facility. So these types of calls requested by healthcare professionals, we send the first responders out, and we do not transfer to 988. The second category is pretty straightforward. If there's physical violence or aggression that's been reported, then we will dispatch out. So weapons reported, suicide attempt, overdoses, physical harm has occurred, or the caller feels in danger. Excuse me, I'm on some new meds that make my mouth very dry when I'm talking, and I talk a lot, so it's a double whammy. The next is if the caller or law enforcement requests dispatch. So if the caller themselves says, dials 911, and they request to be transported to the emergency department, to the crisis triage center, or to a mental health facility, we'll, of course, dispatch the responders out on that. Also, if law enforcement arrives on scene and determines that EMS is needed for transport, then they'll let us know, and we'll dispatch those calls out. When a third-party caller calls us and they have little or no information, sometimes these calls will come from neighbors, bystanders, people walking down the street, people in a public location, and they'll call saying that someone needs help, but they're not with the person. They can't give us any information about, for us to further classify this call. They're usually not with the person, so the call isn't really, wouldn't be any good to transfer to 988. You'd have a third-party caller not knowing, not needing the intervention, and we're unable to determine if the scene is safe. So in these circumstances, we'll also automatically dispatch. Now, here's the data we've collected since 988 came into existence. And what you see down the first column are the call types that I just went over on the slides, the ones that we do not transfer to 988. Then the third from the bottom are calls that our quality assurance department has determined could have been candidates to transfer to 988, but they were not transferred to 988 for one reason or another. And then the second to last row, calls transferred to 988. These are the calls that are actually transferred to 988. And then the bottom row shows the percentage of the calls that could have been transferred to 988 that actually were transferred to 988. So, and that were eligible to transfer to 988. So of all the calls that came in, so if you look at the top two rows for July, there were 254 calls of the behavioral and suicidal combined. And of those calls, 5.5% of them potentially could have been transferred over to 988 and were not transferred over to 988. So the statistics we're tracking, one thing that I said I wanted to come back to, with that line graph, if you look at the number of calls, the first two rows at the top that are coming in, that those numbers are pretty static. We were expecting to see a dip of some kind in the number of calls we're receiving from 911 for behavioral health emergencies when 988 came into effect. We haven't really seen that. I don't know if we have enough data for a statistical answer as to why. It may be that, because 988 is receiving quite a bit of calls, it may be that the people that were hesitant to call 911 to begin with are just now going directly to 988. And then the ones that were used to calling 911 may have not gotten the message or transferred over to wanting to dial 988 directly. But this is the data that we've been tracking, and we're continuing to track this on a monthly basis. This is what that data looks like, the number of calls that we're getting, those first two rows on the table, previous table. It shows the total number of behavioral health calls that we're receiving a month and the total number of suicidal calls or suicidal ideation calls that we're receiving. And like I said, the line is pretty static statistically at this point. We've been meeting and collaborating with mental health providers, behavioral health providers, since before July of 2022. MIRVDA has been participating in the National Emergency Number Association, which is an industry trade group. They had a 988 work group that were putting together best practices, policies, and procedures. MIRVDA has been participating in the Doña County Crisis Now Model Committee. And then MIRVDA has been having weekly meetings with the Crisis Triage Center in 988, and we recently added Project Light to participate in those meetings. And we use those meetings to tweak protocol, go over successes, failures, to try to improve the system, and it's a cooperative effort between all those groups. There are invited members from some of the agencies we participate with here today that they're in the audience, so that the council is able to get a 360 view. If they have any questions for me, I want to answer them, and they could hear the same answer from our partner agencies if they so choose. Jamie Michael from the County Health Director is here in the audience. Karina Diaz with the Crisis Triage Center is here. Battalion Chief Hiles with Light is here, and I don't know if she made it, but Wendy Linebrink Allison from the 988 Center was supposed to be here via Zoom. And with that, I'll stand for any questions the council may have.
Hugo, I think Wendy is on Zoom. I was told that she had connected. Wendy, are you available?
Yes, sir, I'm here.
Can you speak up just a little bit louder, please?
Yes, sir, I'm here.
Okay, great. Did you have any comments that you'd like to say or start off with?
The only comment I'd like to share is that we're grateful to be here in partnership with the Sea Valley Regional Dispatch Authority in order to work collaboratively for the community members of Doña County, and are here to answer any questions you might have regarding any partnerships or services we render.
Okay, and Wendy, can you do me a favor and state your full name and your position and organization, please?
Yes, sir. My name is Wendy Linebrink Allison. I am the Program Manager at Protocol Services, and I support the 988 Crisis Line System of Care.
Great, I appreciate it. Do you have questions? Councilor Bencomo.
Yes, I have tons of questions. Thank you. Thank you all so much for being here, and the other folks as well. I really appreciate it. Is this the end of your presentation?
Yes, Councilor, it is.
I was hoping to see perhaps a similar, like the graph that you showed, the flow chart for how your dispatchers then are determining calls that come to 911 that will go to Project Light. That is something I'd be really interested in understanding how that would work and where Project Light could really fit in a lot of these in-betweens that you're saying, no, we're not transferring to 988, yet I feel like could potentially go to Project Light instead.
Thank you, Counselor, for bringing that up. And let me add to this. This is a chart you were discussing. This is a chart that we started the program with, and this chart that we continue with. Our weekly meeting that I had told you about, that we were meeting with 988, the Crisis Triage Center, and then we've brought in Project Light recently within the last month. Our meeting is exactly to tweak that. In fact, one of the tweaks that we've made is we have gone, in addition to these automatic no dispatch and the ones to consider dispatch, we decided to take a more proactive approach, and we looked at the close to 300 different call types that we had. And we did this in coordination with 988 in the Crisis Triage Center. And we went down and we were able to pull out, I believe, 16 different call types that weren't these call types. I'll give you an example. One is an incorrigible child, the dispatch. And we looked at those. We went and we pulled out several months worth of call data to specifically look at when somebody calls for an incorrigible child, what's going on in the background. And so for that type code, we determined, you know what? This is a type code that law enforcement will not normally respond to. And this is something that EMS sometimes responds to because the parents are just totally not able to control the situation. They don't know what to do. So in discussion, we said, hey, you know what? This is a perfect example of a call that could go to 988. So we've then looked at it, and we've taken 8 of those type codes, and now in our flow chart for the dispatchers when they're doing the interrogation, at the end of the flow chart, it is now proactively telling them, consider sending this call to 988. I don't, off the top of my head, have the total list of the ones that we went to, but I can send it to you after the meeting to all the counselors to look at. So we have been proactive in tweaking this to look at that. As far as Project Light goes, they have very specific type codes that they are going to respond to. Behavioral health is one of them. Mm-hmm. So although it doesn't show on this slide here, this was previous to Project Light coming online, the list that the battalion chief went over with you when he did the work session here for you is now integrated into our computer to dispatch. So when that type code comes up, it's an automatic tone out for Project Light to go to those calls. And in working with the 988th Crisis Triage Center and now with Project Light, we're looking for the future to look at even possibly expanding that. Is that going to be an expansion? Project Light's only a month old. We're not going to overload them with anything right now, but that's something that we're always open to, is looking at and reassessing this on a regular basis.
So the codes that you are now using, I feel like for this flow chart, there would be an additional one under yes, right? Around what is then going to go to Project Light. Perhaps it's Project Light and law enforcement. Who's playing a lead on that call, right? Like I would really like us to get to like some of the nitty gritty on that, because I really believe in crisis intervention. I believe that is a true and tried model. I believe that model works to save lives. I've been having great conversations with Director Michaels, and at the end of the day, a behavioral health call is not a crime, right? Someone who is suffering through a behavioral health episode, that is not inherently a crime. And so I'm trying to figure out the process for how Project Light will be tapped into. And so you're saying that those codes, those came directly from leadership at Project Light?
Yes, Counselor, that's correct. So I believe there are 5 different type codes that they gave us that said we want to be dispatched always to these types of calls. And we've been doing that since the 6th now, dispatching them to those types of calls. As far as MRFDA goes, we've always had the philosophy that as Project Light develops and becomes established, it's been only on for less than a month now, but as it gets established, I'm sure that they're going to look at their data and say, you know what, maybe these other types codes will be ones that we want to be dispatched to.
Absolutely.
We're fully on board with that.
Absolutely.
Right now, we're just going with the protocol that they gave us, and we've been following that one.
Absolutely, I totally understand that and support that, and I think for me, it would be really helpful to see how that process is going to play out. I think from the big picture, and I have more questions just around your presentation, is that I think this is a big culture shift for dispatch, I imagine, right? And so you're having dispatchers who perhaps have been there for years, who've been trained to do this job one way, and now are being asked to look at their job differently, right? Like with a different lens. And I understand that must be really scary, and there's the big liability, right? And that there's like some risk to this, and I think it's, the more that we build up the system, I think the more comfortable and the more confident dispatchers will become in order to determine how to code a call. And so I'm wondering, given that, couple of things that I felt were somewhat broad, when you're talking about behavioral health, behavioral issues, that's very broad. How are you defining that?
Thank you, Counselor. First of all, you're right in the hardest part of the whole process in transition to 988, and even before 988, when we were working with the New Mexico crisis line, is the paradigm shift for the dispatchers. Dispatchers are very type A personality people. They're there to take control of the call and to make decisions as to what needs to be dispatched out. You know, the little joke is that the dispatchers tell the cops where to go every day, you know? So that has definitely been a challenge. And through training and through little tweaks in the protocol, we've tried to break that barrier, but it's been a very difficult one. And it's not just MERV. If you look statistically nationwide, it's been an issue of getting dispatchers to agree to that. So I think with all things new, it's going to take time to get that paradigm shift. I think the newer dispatchers, like you alluded to, the older ones are more set in their ways. I think the newer ones, as we come in, we're getting them right off the street with no preconceived notions, and we're teaching them the protocol. And I think we'll end up seeing that they'll adapt to this a lot easier. Now, as far as your second question go, what does behavioral health entail? A lot of things. You're right, it's a very broad category. Most dispatch centers, that's the category that they use. What happens is that when we do the emergency medical interrogation, the questions go through a flow chart. And it'll say, you know, it'll ask questions about if there's violence, you know, are they on medications, a lot of different questions that then at the end will help the dispatcher decide what are the resources to send to the call. But it's all done in the background of the software that we use for that. But it's not uncommon that a lot of dispatch centers throughout the country have maybe 3 or 4 type codes only that deal with behavioral health issues.
Thank you.
Mr. Hugo and Councilor Bencomo, this is Wendy with the New Mexico Crisis Line. May I chime in for a second?
Yes, please.
Thank you so much. I'm so thankful that Councilor Bencomo has mentioned the concern that it's not a crime to request services, and because you're experiencing mental health, you shouldn't have to necessarily go through the behavioral health system, and is looking to understand how to better support people that are reaching out to 911 that are experiencing mental health concerns in a different manner. And the Crisis Now response system of care that myself, Karina from RI, Crisis Triage Center, and the RI Mobile Crisis Team, and Jamie Michael from the Dona Ana County Health and Human Services team are working on is a way to ensure that we're creating a different type of response for people with behavioral health needs. And as Mr. Custo mentioned, you know, change takes time, and that's not only for us call takers, but also for the people. And right now, the people know that when they need support and they are in crisis, they call 911. And so it's up to all of us as a community to ensure that we are, making sure people understand that when they're having a mental health or emotional or behavioral crisis, that they can reach out to 988 and to try to find additional pathways in our 911 system to get those engagements streamlined from 911 to 988, because the Crisis Triage Center does have a mobile crisis team that is dispatched through the 988 Crisis Center. And so I'd like to also ensure that we're not just looking at the Project Light dispatches that are made through 911, but also taking the public safety aspect out of it completely and putting behavioral health professionals into the field from the Crisis Triage Center that could be dispatched to people through the 988 system if we can strengthen the engagements between getting 911 to transfer those calls over to 988 to get a behavioral health response to those people.
Thank you, Wendy. I really appreciate your additional context on that. I'm really glad you're on. Thank you. I think I had a similar question in regard to the broadness of it around unusual behavior and how your, Mr. Costa, that's on, yeah, thank you, how you're defining that.
You're referring to the
second box, is there any unusual or aggressive behavior?
Yes, unusual behavior is, it's pretty much subjective to what the dispatcher is hearing and getting the information from the caller. So for example, a third-party caller calls and says there's an elderly gentleman that's walking down the middle of the road. I think everybody would agree that that's unusual behavior. People don't usually walk down the middle of the road. So that's just a simple example, but it's things like that. Anything that would be considered out of the norm, something that you normally don't hear that people are doing or don't hear that that is occurring. Somebody is climbing over my neighbor's fence. That's another unusual behavior. So as far as behavioral health calls, it basically falls on the dispatcher to be able to listen to what the caller is saying. Sometimes it involves background information that they're hearing from other parties in the background or ambient noise in the background as to what's going on. But then they have to make that determination. Is what I'm hearing or what I'm being told something that would be considered something normal, a day-to-day routine, or is it something that is not normal day-to-day routine? But beyond that, it's not the only criteria that they use. The other criteria they use are there known weapons, is there known drug use, different things like that. But it's something that's subjective, but based on their training and their experience on taking 911 calls, it would be something that they would determine, the dispatcher.
I appreciate what you said about type A people, but also around dispatchers using some sense of intuition and gut checking, right? I really appreciate that. I think that's important, and I think that also requires cultivating those kinds of things, right? And so, again, given that there is this big paradigm shift, as you said, I know that there's a lot of training, but I'm wondering, what would you need? What would your dispatchers need to, I don't want to say that there is resistance, right? But I imagine the veteran dispatchers are definitely feeling like this is a bit of a jolt. And so what do you feel like you would need that we could support you with to help make this transition easier? Because while it takes time, and I agree with that, I also feel like the risk is big, right? What is at risk here and what is at stake here are lives, and really moving towards taking ownership of this kind of model is critical.
Thank you, Counselor. I agree with everything you said. I can't tell you what dispatch would need to accomplish what you're saying. I can tell you what we're doing to try to accomplish it. Part of the solution that we thought was very important from day one was this really strong quality assurance system. And what we do is we've been pulling all these calls, all the behavioral health calls, all the suicidal ideation, suicidal attempt calls, and they've been scrutinized by quality assurance. And the quality assurance goes through and listens to the audio. They look at the video of the actual data entry, and they read the printed copies of the dispatch report. There's certain criteria that they're looking for to see that if it was accomplished. And then the dispatchers or call takers that did that call are brought in, and the case call is reviewed with them. And one of the things that our quality assurance tries to do is they try to get in the head of that call taker or dispatcher by having them listen to the call, read it, and say, well, why did you determine this, or why did you understand that XYZ was happening? And through that call review process, it's almost like Monday morning quarterback. Sometimes, you know, I think if we were to listen to ourselves a day later on some phone calls that we do, we'd be surprised. Did I really say that, or did I really think that after that phone call? So that's been a great help to us. We're always looking to tweak the protocol, and I think by being partners with both 988 Crisis Triage Center and the Health Department, I think we get some input from them as to also how to tweak it. Physically, like I said, I don't know if there's anything that I could say we need X, Y, Z in front of us, because I think our dispatchers get a lot of training. They get QA'd on a lot of the calls that they do, and right now they're getting QA'd on all the behavioral health calls. So I think, unfortunately, I think the answer is that it's going to take time. People getting through the QA process, thinking back on the next call that comes, hey, this is what I didn't do that I should have done on the previous call, and, you know, learning through that. But let me tell you, I think that, like I said, if you look nationwide, it's been growing pains with the whole behavioral health in 988. And to be honest with you, most of the dispatch centers in the state of New Mexico are not doing what we're doing. And you talk about liability, and I say to my counterparts, I think it's there's more liability if you dispatch something out that could have gone to 988 and something goes wrong than it is to not dispatch to transfer to 988, because I think a lot of the other centers are hesitant to transfer to 988 because they have perceived liability issues, which I personally don't see.
Thank you for that additional context. I appreciate that. And Wendy, I would honestly have the same question for you. I'm curious if you as the 988 program manager could talk about what you see are needed with dispatch centers, ours particularly. And then also, while I'm on the microphone, will you go to the graph where you had the calls that could have been transferred to 988? And I'm wondering if, Wendy, if you could talk about these numbers and what you're seeing on your end.
Thank you, Councilor Bencomo. I just want to start with saying that we are grateful that we have the opportunity to work with Dona Ana County, as we do have a memorandum of understanding with the Mesilla Valley Regional Dispatch Authority in order to have them transfer calls to us. And we have been working with the Hugo and his team for several years now in order to try to find ways to help build those pathways. And in my perspective, one of the things that I've shared with Hugo is that when I hear the conversations about you're doing quality review and you're talking with them about why didn't you transfer that, or this would have been a good call to have transferred. One of the suggestions I've made in one of our recent monthly meetings that we have, or weekly meetings actually that we have, is that rather than laying the responsibility upon the call taker to make the decision, embedding it into the workflow of decisions that they have in their system that says, if this, then this, so is that it's very clear to the call takers to make those changes and make those determinations, so is that it's not them feeling like maybe I should, maybe I shouldn't, uncertainty, but the system is telling them, you know, that this is a good call for 988 to be engaged with, whether it's engagement with public safety or engagement instead of public safety. And I think that that would be a huge benefit if it's, if the software was developed and updated to reflect those changes is one of my first thoughts. So is that you take out the human factor, where people are hesitant to make the wrong decision.
Thank you, I appreciate that. So Wendy, are you saying that that software does not exist currently?
The software does exist in the dispatch authority. From what I understand from our conversations with Hugo, it would just be a matter of them needing to make additional programming changes within it so as that they can make those changes, from what I understand from conversations with Hugo and Albert.
Okay.
Councilor, if I can add to that. Yes, behind the scenes in the software, there's the algorithm that the dispatcher doesn't see. They just see the questions that they're asking, and depending on the answer, the program will jump. So in the back of the algorithm, there is the opportunity to add things in. And we're exploring that right now with the software vendor. And but the issue is, it's going to be a complicated process, because if we're going to add 988 as something at the end of that tree, we want to make sure we don't break anything in the path, and then something that should have gone to dispatch, for example, is now broken and it goes the other way. So it's something we are looking into doing, but it's not going to be a quick or easy fix. It's something that's definitely going to be down the road. But we've started that process, reaching out to the vendor to ask them for costs and for development and engineering on that.
Will you keep the city manager informed about that? Because that is something I would be interested in supporting if it came down to funding and you needed that. That is something I feel like would be critical.
Absolutely will. Thank you.
And then just my last question. Oh, sorry, Wendy, go ahead.
Thank you, Councilor. I was just going to say, that decision tree is something that has been implemented in other communities throughout the nation. And so, as Hugo mentioned, I think that a decision tree that lends to why did you dispatch public safety instead of 988, and then a critical incident occurred as a result of that decision, which could have been avoided by transferring to 988, is a positive thing to work towards, so as that we can make sure we are getting the right people at the right time to engage with the situation that's occurring, because sometimes all they need is a conversation, which is what our mental health counselors offer. 988 is a lot different than 911 in the sense that our primary goal is to try to de-escalate the situation on the call rather than just a determination on who should go to that person. And we work in the least restrictive approach possible. And so we have decision trees in our processes that determine, are you able to support this call right now, this community member right now on the call, or do we need to engage them in a referral to community services? Do we need to reach out to the mobile crisis team in the community to ask for them to go to them? Or if there's a higher level of need because there's a risk of medical necessity or weapons and other physical violent risk, then that's when we escalate up to mobile to public safety responses. But to make sure that we are looking at how do we get the right people at the right time for the specific situation, I think I'm really feeling relief hearing you, Councilor, talk about wanting the desire to continue to move this forward, so thank you. And you wanted to ask me a question about the graph?
Yes.
I'm sorry, I'm not able to control it anymore for some reason.
That's okay. You know what? I'll move on. I've taken a lot of time already, and maybe my colleagues will follow up on that. But the last thing I wanted to say was that I think we're now in a good place in providing. There's options, right? We have 988, we have Project Light, we have the 911 system, and I think for me, really, like, the vision is to go deeper on this flowchart and determine what goes only to 988, what will go to Project Light, what is needed, when is law enforcement truly necessary when we're talking in the context of behavioral health. I think often when someone is experiencing a behavioral health issue, the mere presence of a law enforcement uniform can escalate the situation. And now we have Project Light, these trained professionals, EMS folks, fire, who are incredibly trusted in our community, right, with the ability to show up and potentially diffuse a situation. And so I think we're in a really good place, and I really want us to take full advantage of this environment that we are in and invest in it, fund it, but then also just really think about the strategy in which we want it to operate. So I just really want to thank you all, definitely you as well, Wendy, for coming on and for the presentation. Thank you.
Thank you, Councilor. Councilor Graham, the Mayor Pro Tem.
Thanks, Mayor. Thanks, everyone. Wendy, Hugo, for all of the information so far. Hugo, I know you've lost control of the slideshow, and I don't know if this is, if these are numbers that you have on hand, but when we're looking at those behavioral calls and adding in suicidal ideation attempt, ballpark, how many of those are unique callers and how many are repeat callers, or maybe even what we might think of as frequent utilizers?
Thank you, Councilor. That's a great question, and I wish I had anticipated it because I would have brought you some data. We do, I can't tell you offhand how many of those numbers are the frequent utilizers, but they're significant. One of the most frustrating thing for the dispatcher is dealing with those callers, and I'll tell you, a lot of those callers have their favorite dispatchers, people that they know and they trust and they want to speak with. And our dispatchers, I'm proud to say, take the time to do that. But one of the most frustrating thing for the dispatcher is that it almost seems sometimes that there's a revolving door in mental health. And that's where they've been their frustration. And MERV has been a part of the Crisis Now team here in the county since its inception. And that's one of the things that the Crisis Now is trying to alleviate, trying to close that revolving door to get it. We've made referrals in the past to mental health resources. The police department also has a list of those frequent utilizers, but it is a challenge. And I wouldn't say 50%, but I'd say probably at least a third of those are the frequent callers.
Wow, that's, I guess, surprising and not surprising at the same time. Recognizing, of course, that ideally we are wanting to plug these folks into wraparound services so they're not relying on 911, but that's a long-term process. That's a lot of gathering of resources and collaboration. I've been doing a lot of side reading on this, and just recognizing how crucial dispatch is in this entire system. One thing I was interested in, again, this was just from some additional reading I was doing and thinking about those frequent utilizers, I was looking at software programs that can create a flagging system, maybe not the best term for it, but if we have a frequent utilizer, we have deep history with them, but maybe not everyone on CAD knows this. I read about some shortcuts to provide background information, whether those responders are light, regular fire EMS, PD. Can you speak to that at all?
Sure, Counselor, thank you. We do have that. We have what we call a CAD flag. CAD is computer-aided dispatch. And what we do is for specific addresses that are known to have frequent utilizer, we will flag it. A lot of times those flags come from the field units. EMS will let us know, hey, can you flag this address because this person does not like to see uniformed law enforcement, so we'll flag that. And we'll let the responders know if we're dispatching them out what that flag is. Sometimes it comes from law enforcement. We do have the flags and we utilize them. The only weakness of the flags is that it is location specific. So we could flag 700 North Main Street, and then calls that come from there would pop up that flag for the dispatch. But we can't flag Joe Smith. because Joe Smith could be anywhere. What we can do, though, and what we've encouraged the public, and this is a segue to another service that we provide, is we have a system called Smart 911. And we've encouraged mental health providers, caretakers, that if they have clients or people that they know have crisis situations, they can create an account for them that's tied into a telephone number, not a location, so the person can be anywhere when they call 911. And in addition to any cautions, they can put in medication lists, they can put in medical histories, anything that they want to share that the dispatcher can then convey to the first responders, and also use that to make an educated decision as to how to dispatch out. That information, private information, is only available for 15 minutes after that call is done, so the dispatchers can't go and search people and try to find that information. So it's a very secure system. But that's another alternative to the flagging. Because like I said, flagging is location specific, where if you create a Smart 911 protocol profile, it follows you wherever you go, and nationwide, in fact. And just to encourage people to do that, it's smart911.com to do your profile, or you can get the link from the MRVDA website, mvrda.org.
Thank you so much for that. That was actually one of the programs that I had read about, and I appreciate you saying, like, this is a place where anyone can take this into their hands and provide that information, pointing out it's a consent-based system, so, it's not as if you would get entered into that against your will. But yeah, I was really interested, and thank you for providing that information. And then my final question, Chief Dominguez, I'm going to have to look at you and make you be the whole police department, as usual. If PD is dispatched to a scene and feels like, hey, this is a great opportunity for Project Light, maybe this is more in their wheelhouse, do you have policies, procedures, operations to make that happen?
Mayor, Councilor Graham, the answer is yes. We're always looking for ways to incorporate resources that will not require law enforcement intervention. So if Project Light is available, we will call them, but we will also call other resources if necessary.
Okay, fantastic. But you are doing those kind of handoffs in situations where it's warranted?
Yes.
Okay, great. Thank you so much. That's all I have. Thank you, Mayor.
Thank you. Mayor Pro Tem.
Thank you. Thank you, Hugo, and those of you on the audience. It's good to see you all. I was looking forward to this, to see what the connections were with 911 and 988. And Hugo or Jamie, I know she's out in the audience. Just to familiarize, or have folks familiarize themselves with the Crisis Now process. Can you talk specifically about that and what makes it different than other evidence-based programming?
I'd refer to Ms. Michael for that. We've been involved in it, but she's the one who set it up, and she's definitely the subject matter expert on this.
Yes, thank you.
Thank you. Good afternoon. Jamie Michael, Doña Ana County Health and Human Services Department. The Crisis Now model is a national model that is pushed out by the National Substance Abuse and Mental Health Services Administration. It's part of the U.S. Health and Human Services, and it is the best practice model for creating a response system for people who are having a behavioral health crisis. It includes 3 components. One is someone to call, which is Wendy's team at 988. Someone to come to you, which is the mobile crisis team at the Crisis Triage Center. And the third component is somewhere to go, which is a crisis receiving center. This model came to be after many decades of looking at real-world data and looking at communities where they studied the types of calls and the types of circumstances that came as a result of behavioral health emergencies. There were in one study, there were over 1 million encounters that were looked at. And that's how they came up with, what do we need? We need, in all of these circumstances, it would have been great to have a crisis counselor and have someone for them to talk to. They looked at how many people needed someone to come to them. The crisis counselor over the phone wasn't enough. And then they looked at how many people the crisis couldn't be resolved with a mobile team. So they said, okay, now for some people, we need somewhere to go. So it includes those three components, and it is based in real data that was collected. And it also, part of that process, it includes looking at the same things that Hugo looks at. Is this a situation where someone has already taken an overdose or someone has already harmed themselves? So it also includes, when do we need to engage EMS? When do we need to engage law enforcement because it's a public safety? So the Crisis Now model has all of that built in. Again, it's based on all of this real-world data. It's based on interviewing people who say a behavioral health crisis is not a criminal situation. It needs a different response. It's also reimbursed by Medicaid, so that's helpful for local governments when we're looking at how to finance these systems.
Jamie, thank you. You mentioned when you talked about someone to come to you, right, that you mentioned the county mobile unit that you've developed through RI, but not the light. Why is that, and what sort of conversations have you been having with Light so that we're not duplicating services and addressing the needs of the city as a whole?
Thank you, Counselor. So Project Light is designed as a co-response model, so it's embedded within EMS. It's dispatched through 911. It is outside of the Crisis Now model. One of the original intents of the Crisis Now model was to look at how do we bring the right services to the person at the right time. So EMS is not needed at every call, just like law enforcement is not needed at every call. So that's why the mobile crisis that's designed to be part of the Crisis Now model includes a clinician and a peer, versus a co-response model with a paramedic or law enforcement and social workers. But we have been talking with the city, and again, as Hugo said, the folks from Project Light have joined their weekly meetings, and we've been trying to figure out how to run these two mobile teams parallel in our community, and what services or what circumstances should each respond to.
And where are you at?
I think there's still some gray area, actually. So in the table, the flow chart that Hugo talked about in those three call types, I think we need to do a few more things. And again, we're way above and far beyond what other communities are doing, and it's because of the willingness of all of our partners, and it is a big change. But when we talk about what kind of training or what kind of conversations should we be having to help make this change, because I can't just cross my fingers and hope really hard that the change is going to happen. We have to be proactive in making this change. So the behavioral suicidal subject, I think those two call types, I think we need to really change how we look at that. Why isn't 988 the first response to all of those calls? And then let's look at, okay, of those calls, how many do you think should have had an EMS response, or how many do you think need law enforcement response? And I'm not including the suicide attempt, because I think by then there's probably a medical emergency. But let's take the opposite effect. When in doubt, all of these calls, let's make them all eligible for 988 or a mobile crisis response or a behavioral health response. And then from there, look at which ones need EMS and which ones need public safety. That might get us to our end goal sooner. And then the other thing that just hit me while we were talking about this, if we're seeing 988 separate from this system and a transfer to 988, then I can see why people would be hesitant to use that service. But we also have to remember that 988 on its own is a service. It's an intervention. So you should think, as a dispatcher, I can dispatch a police officer, I can dispatch a paramedic, or I can dispatch a crisis counselor. And that dispatch looks different because it's connecting somebody through a phone to transfer, but it's still a dispatch and connecting someone to services versus it being kind of outside of the system and on the side. So I was just trying to think about how do we get the training and how do we get people to start reflecting on these calls and these circumstances differently.
So in these weekly communications, and this is both to Hugo and to Jamie, what sort of conversations are being had related to that very thing? Because there should be more transfers to 988, given the data that you showed me. I mean, and I'll just preface this. I've been on that side. I took calls for many years ago when I worked at Children, Youth, and Families Department, right? And we had a framework that we worked in and questions that we had to ask, and sometimes they were crisis-driven, where we were notifying police to go and respond to these things, and sometimes it was mental health issues, those things. So I do understand that and what the numerous types of calls that your dispatcher is having to deal with. So I just want to be sure that those conversations are being had, or how do we get to that next point, because I think it really, really matters who we're dispatching out to as we're trying to address the continuum of care that people are, no wrong door. There's no wrong door, and I know that you believe that, and as well, that's a philosophy I think that we've tried to incorporate in this city. So how do we get to that point? Because it feels like we're not quite there yet, or kind of maybe it's liability, I don't know. I just want to I don't get these opportunities really to visit with you other than these times. So I want to be clear about where we need to go and how can we help move things along.
Sure. Thank you, Mayor Pro Tem, councilors. In fact, it's the past 2 months, 2.5 months, that's exactly what the weekly meetings have been doing, is we've been trying to dissect that. And like I stated earlier, we've looked beyond and tried to be proactive, and we've narrowed down 8 different call types to start that automatically we want the dispatchers to say, this is something that definitely could go over to 988. So we've been doing that. One thing we did do, though, when we started pulling the data and started, crunching it and looking at the numbers, there's still a lot of public education that has to be done, too.
Yes.
One of the things is that if the public is more aware that 988 is there and it's available, that's going to decrease the need to call 911 to begin with, and it's going to take it totally out of that whole decision tree of the dispatchers. And also, part of that public education still needs to come, and I've talked with Ms. Michael about this, from the healthcare side, because we're still seeing private practitioners that are using 911 to get their clients into the system. And the question is, we don't know what's going on, they're the professional, but could some of those calls have gone to 988 as the intervention versus coming to 911? So there's a whole list of, and it's happening in schools too, for example. Schools are, the school medical staff are calling 988 and not calling 911 and not utilizing the 980 system. So I think in conjunction to this, what we're doing, we are doing this at the weekly meetings, trying to dissect this down. And as Wendy had mentioned, we're looking into putting into the software itself part of that decision tree. But on top of it, I think public education still is a really, really important thing that needs to continue.
So Jamie, where are we at with that, and how can the city help sort of bring folks up to speed about 988 and when to call? I know there's some tools and graphics and those things, but I'm wondering if maybe more specific things about maybe if this happens, this is where you should go. Instead of tying up the 911 system, those things, and maybe it's a different public awareness campaign.
Mayor Pro Tem, council members, you're exactly right. We need to do more public education in general. Everyone should know 988 just like they know 911, and it took decades for us to be able to to understand and know when to call 911. So we're trying to unwind a system. So there is printed material that each of your departments within city government can access through SAMHSA's website for free. The county accesses, we get as much free material as we can, and then we do have a budget to print materials, so we can just scatter the 988 information across the public. And then in order to be more precise and more targeted outreach, the data that Hugo shares with us is extremely important. So we looked at, well, what healthcare providers are calling 911? Why is this happening? So now we know who those providers are, and we have hired a consultant to go out and meet with those providers individually and say, look, let's figure out how to bring the Crisis Now model, 988, crisis triage, mobile crisis. How do you use those as part of your treatment plan for your clients? I think we can do the same thing for CYFD and their families. How do we build in this as just a natural resource for families in the community that we think might be most likely to need these services? So we have a consultant that will be doing some one-on-one provider education. We, again, look at calls and just communication. So Sergeant McCord was able to visit with him last week. He went to one of the residential rehab hospitals here in town to respond to a behavioral health call. We didn't need a law enforcement going into a hospital to respond to someone who was having feelings of suicide. The person was not able to move because it was a rehab hospital. It was a safe environment because we knew that the likelihood of a weapon was very slim. The individual might have been able to talk to someone on the phone and ease their symptoms. A mobile team response from the Crisis Triage Center with a clinician and a peer might have done it. And even if the individual from a medical facility needs a transport, I think the folks at the Crisis Triage Center are really able to coordinate those types of transports if you do need a higher level of care. So now beginning to branch out, okay, we need to talk to the skilled nursing facilities, the rehab hospitals, all of those other organizations that are still thinking 911 is my only option. Mm-hmm. And that's the type of education that we've started.
So Jamie, I know that I've seen the printed material. I know that it's easy accessible, hopefully, for most people, but I'm thinking along the lines of something like that, very specific to healthcare orgs and providers, and then someone like you're an everyday person that sees something out in the streets and there's a crisis of sorts, and you're seeing these things, recognizing. I think people really need, aside from spending 2 days, 8 hours plus, like a mental health first aid, some sort of a flow chart of sorts for the average person that's encountering these things, and we're encountering them so much more, right? Businesses, residents. I mean, we get probably more calls about that and how to address it, or who do we call? And so I'm thinking those types of flow charts for different types of, categorical people that are encountering these, I think would be helpful. So that's outside of those printed materials and the things that SAMHSA has. So it's more specific to our communities. And so how do we do that in accordance to what you're all trying to do here, and with the 911 and 988. I don't think there's anything like that I've heard statewide, but could be very helpful. And maybe, I know Wendy's still on the line, maybe she can address some of that.
Mayor Pro Tem, thank you so much. I know that in your community, there is a CCVHC that has been identified, which is FYI Plus, and part of their role will be in helping to support people from birth to death and engagement of care through their lifetime, and navigating through crisis is a component of that. And so they're still in the implementation stages of mapping that out, and so I think that there's more to come where we would be inviting FYI Plus to these conversations to help support support that mapping out, because I think that that is a part of their role as a CCBHC.
Very good. Thank you. Thank you for that. I think we'll make sure that they're a part of these conversations if they're not already. And then Hugo, I couldn't help but to cringe just a little bit when I heard the word interrogation, right? Quote unquote. It feels really, that feels like a very serious, and it makes me feel like there needs to continue to be this paradigm shift, because if you're interrogating people to get information, I'm feeling that's not the most trauma-informed way to address mental health calls with people that are in crisis, and it's something that I wanna just speak to. There's a tremendous amount of trauma-informed classes and trainings and such that I would recommend that you and dispatch and people who belong to this multidisciplinary team, people from the city, from Light, that we should contract with somebody to do that training ongoing. I think it's very important. I don't want anybody to feel like they're being interrogated for, calling 911 specific to mental health calls in 988. And so please help me mitigate, alleviate the stress I heard when I heard interrogation.
Mayor Pro Tem, thank you for that. My apologies. It's just a term that's frequently used for emergency medical dispatch. When I say interrogation, what it is, it's a series of questions that are asked. They're not asked in a threatening manner by any means. And I think if you listen to any of the call take recordings, you'll see that they're very compassionate in asking the questions that they do ask. But I'm very welcome to receive an alternate term. I liked Councilor Graham's frequent utilizer. That's a great term that I'm going to start using now, aside from other terms. So I'd be happy to entertain any other term that you would have for that.
I think Wendy had a great idea in bringing in FYI Innovation Plus, who really is the leader in, trauma-informed care. And there's just other providers that I know in our community that have received very specific training related to trauma, being trauma-informed, and I think anymore, the way we are identifying folks, the way we speak, about them and for them and with them, it has to be very trauma-informed, and so I'll definitely reach out to EFO and others to give you some training opportunities that are coming our way frequently related to that I would encourage the dispatchers to be a part of. And lastly, I'll say this because it's been brought to my attention, and I've mentioned it somewhat in our Health Policy Review Committee, is I also believe wholeheartedly in peers. And training up our peers and utilizing peers wherever we can. I know that is something that we've not had the discussion in its entirety, for our Project Light, and something that I feel like we need to consider as we're, moving through being more acquainted, with what's happening in our community. And so, EFO, I'd really like to have those conversations in our Health Policy Review Committee related to how Project Light is going to utilize peers in this process, something I think that's really important, and where the public and where folks, having someone to speak to related to the same sorts of issues that you're experiencing, it goes so much further. There's all that data out there that suggests that. So I want to make sure that we're having those conversations, and when we can plug in peers, that we should do that. A peer specialist is so important, and I know we don't have one specifically for Project Light. Yes, Jamie?
Mayor Pro Tem, members of the council, just to follow up on a few quick points. Hugo, years ago, we did a trauma-informed training with your team, but it's probably time again. And the third week of April, we are hosting Train the Trainer. So by the end of April, there'll be 10 new instructors in Las Cruces, and it's trauma in the criminal justice system. And FYI Plus is involved in that, as well as many of the other partners in the community. So we will have more instructors and be able to roll that out. So if the city wants to host a specific training around that, we can do that. And then I think that one's specifically for in the criminal justice system. So we can look at other types of trauma trainings that are available. FYI Plus is part of the city-county Crisis Now work group, especially because they are in the process of developing a response team for adolescents. Right now, the mobile team and the Crisis Triage Center are adult only. So that leaves a huge gap. And when we looked at the data from MRVDA, schools are calling 911. So we need to create that availability for somebody to respond. And peer support workers, you are absolutely correct. That's why the Crisis Now model requires peers at the receiving centers and as part of mobile crisis. And in order to get qualified for Medicaid reimbursement, you have to have peers. I think one benefit we have in our community is RI International has more peer employees than other. Most of their employees are peer support workers as opposed to other types of providers, and they have, again, nationally recognized training for peers and are working with the state Office of Peer Support and Recovery, because what they've identified as the most important thing is having the appropriate supervision and support for peers once they are employed with the organization. So I think there's opportunity for RI and the city to partner in not only creating peer support positions, but supervising and supporting peers in employment.
Thank you, Jamie. I really appreciate it. And then because you reminded me about our youth, and I'm not surprised that that's happening. Hugo, you mentioned of an incorrigible youth. I'm thinking we should really sift through that a little more, because what I'm hearing, and I hear it from providers, I hear it from family members, that these are, I know what an incorrigible youth is, and all of them can be at different points in time, right? But I think it's more serious than just an incorrigible youth. I think it's youth that have a severe mental health issue, or maybe haven't quite been diagnosed with one, a diagnosis, and their parents are struggling to contain them at home, right? And they're becoming aggressive, and there's these, I think, aggression that's occurring in the home, and I think parents don't quite know what to do to include the schools. As you know, we had recently a conversation with the schools related to this, where it's just we're seeing a huge increase of students who are very with aggressive behavior, and teachers, EAs cannot contain them, cannot control them. So what's happening is we're calling law enforcement to help address that, when maybe some of these crises that are like our Project Light and others could help address that very specifically. I think it's becoming a huge issue, one that obviously the schools are now reaching out to others to really bring them into the fold to address those, because they can't contain our kids and the level of aggression that they're experiencing in the schools. So I would like to see more data specific to that. I don't know that the use of incorrigible, it's a very interesting term, and we use it in the criminal justice system for, these are the ones that are the class 3, the kids that get involved in a variety of alleged criminal activity. But I think it's more than that, and I think I become concerned that we're not addressing those issues specifically related to our youth. So I don't know you have anything more to add to that, Jamie or Hugo, in terms of what exactly you're seeing, but I am very concerned about it, and I don't know that we have the answer.
So,
Mayor Pro Tem, this is Wendy with the crisis line before Jamie and Hugo answered. This is an area that we've also requested that the MIRV dispatch center look as potential engagements with 988 in the past, because a lot of times parents or resource parents or foster youth or school systems are at that point where they don't know what to do, and so they've gotten to that point where they're just reaching out to anybody that will help them at this moment. And I think a lot of times it's really more of a conversation that's needed rather than a public safety response in some of these situations. Of course, not when the level of violence has been created, but how can we encourage some of these? In our program, we call them noteworthy callers rather than frequent utilizers, as Councilor Graham mentioned. But I'd like to encourage the MIRV system and the school system to think about engaging 988 more with those community members, so as that we are taking the least restrictive approach. And I'd like to work with Hugo to try to find pathways to support those engagements as well. And I'll hand it over to my partners, Jamie and Hugo, to respond more.
Thank you, Wendy. Thank you for that.
Mayor Pro Tem, this is Jamie Michael again. In addition to 988 being a resource for young people and families, they do have text and chat, and young people have been reaching out a lot through text and chat to 988, so I think that is kind of an upstream approach to help hopefully prevent some of these situations from going to a crisis level. So again, like you said, maybe some targeted outreach to the young people at the school, letting them know that they can text and chat with 988 call takers is important. And the other area, once we looked at some of Hugo's data and we saw, wow, there are a lot of school nurses that are calling 911, we circled back with FYI Plus and asked them if they had the capacity to begin developing a youth mobile crisis response team. The state, through CYFD, through the Children, Youth, and Families Department and the Behavioral Health Services Division, they're piloting this in 4 different counties. Our county was not selected for that pilot, but we've been able to plug FYI Plus into those conversations, so they're part of the design and part of the learning community with the other 4 counties. And we are looking at maybe there's a way that local government can help financially support the startup of those mobile crisis teams until the state can add more pilot projects or until the state has figured out Medicaid funding. And they are slightly different than the crisis response team for adults, where the adult team is meant there's a crisis, you go out, you address the crisis, and you're done. These teams are designed to stay connected with the family for a number of weeks. And if the youth is the one who they're calling because there's a crisis at school, the team works with the entire family, not just with the youth when they're able to. So they really are tailoring this model to address young people and their families. So that's an opportunity for us to build some resources here, but you're right, it is a huge gap right now.
Yeah, appreciate that. Thank you, Mayor. Those are all my questions.
Okay, thank you. Councilor Bencomo?
Sorry, Mayor,
Sorry.
thank you. I have 2 more questions. One of them that I just feel just deeply unclear about still, and this might be for Hugo or BC Hiles, or both of you.
Mayor Pro Tem, can you come back here for just a second? Okay, we're going to have to take a quick recess.
The suspense will build for my question.
Okay, so we'll take a quick recess here. The reason why we had to take a quick recess is we lost a quorum, that's why. So it's 2:29 p.m. and we'll reconvene as soon as possible. Okay, we'll go ahead and reconvene. Thanks for taking care of the coffee, Mayor Pro Tem. We appreciate it. Okay, so it's 2:30 p.m. and we'll go ahead and start.
Thank you. Yes, okay, back to my question that I still feel unclear about. So you've said there's a behavioral health call in the 911 system, and they've determined that there is a behavioral health concern, but that there is a weapon on the scene. As I'm understanding that right now, that immediately then just goes to law enforcement. I guess I'm wondering if it's not going to 988, that's clear to me. So now it's going to law enforcement. When will who determines then when Project Light can be tapped in for a call like that?
Counselor, Mayor, counselors, it's an automatic dispatch. If anything comes into the behavioral health call, regardless of whether the weapon's involved or not, Light is on that dispatch team. Now, with weapons, there is a concern for scene safety. So the first officer on scene would be the one that would be determined whether the scene is safe, and then they would say that Light could come in. And that pretty much your understanding, Chief?
Yes, sir.
So they're not being withheld from dispatch because of there's weapons or any of those yes ones. They're being dispatched automatically. And then scene safety will be determined by law enforcement whether they can move in. And that's standard protocol for EMS and fire also on calls like that.
Okay.
Good afternoon, Mayor, members of council. My name is Matthew Hiles. Just to elaborate a little bit more on that, our 5 call types that we are dispatched to are high acuity calls. Each call is going to require a level of scene security provided by our police department. That being said, they have to deem it safe not only for the person we're responding to, but for those of us responders that are going to be on scene. Once that's deemed clear, then our team, who is outfitted with a firefighter paramedic and a licensed social worker who is trained in de-escalation, holistic, trauma-informed care and therapy with capabilities of transport to any facility in town that's going to be best for that person. Once those responders have figured out the scene is safe, the Light team can then move in, start their assessment, medically clear them, make sure that we don't need to transport them to the emergency department, and then allow our social worker to start intervening, de-escalating the situation and using their trauma-informed care. So each call, the behavioral health, suicidal ideations, suicide attempt, CPR, and overdose, those will require law enforcement to be there, not in the capacity of being in trouble, just to make sure that nothing goes sideways for anything. So it's not that because you call, it's not they're showing up to show a presence of
punitive.
Exactly. It's just to make sure that everybody's safe in the meantime. Law enforcement's been doing a really good job on kind of being in the background of a scene, just having them there, knowing that if we need them, they're there, but they've been very good about just letting our Light teams go in and do their assessments medically and everything like that. So
thanks for sharing that, BC. I think for me that's where the biggest uncertainty still lies. Given certain cases we've seen in the past years, for me this feels the most critical place for a Project Light, ensuring everybody's safety, of course, right? Your folks are not armed, right? And at the same time, not escalating a situation to where someone ends up dead.
correct.
Right? And so for me, this still is, and perhaps what I'll do is continue having conversations with our city manager and our chief one-to-one, just so that I can better ask more pointed questions. But I think for me, this just feels still where there is the biggest uncertainty.
Understood. And just to let you know, right around just before the launch of Light and a little bit after, myself and my team went to PD's briefings, their day shift and swing shift briefings, and we informed them about Project Light, what we're about, how we're there to, how we can help them, how we can integrate on a call, and basically how just make sure that our, scene is safe, and then we can, in a sense, lack of a better term, take that call from them, maybe even allow them just to get back in service because they aren't needed. They are going to get back in service and actually do the patrolling that they need to do and what they showed up for. So there's been a lot of that, a lot of great teamwork with PD and Project Light and AMR. Hugo's been with their dispatching, and my hat's off to them. It's been so helpful. And so we've had a lot of community partners we've been working with. That makes it great. We respond to all ages. We respond to just city limits, but we respond to all ages, incorrigible children. Just the same. We spent 2 hours on a call with a child. Had huge compliment from FYI because we work with FYI weekly, actually on trainings weekly, as well as Peak. We've done trainings with Peak and our teams. And we were on a scene that was pretty difficult, but it was, the light team, PD, and AMR, and everybody was there very patiently, letting the scene play out, and just working with them at that child's pace, and it worked out great. So it is working very well. I understand your concern, but just know that it's going very well.
Thank you so much. Really, thank you very much for that context. Please don't misunderstand. My concern is that I know y'all are doing an excellent job. I have full trust in the system very much. I know I'm so excited to hear that there is incredible teamwork going on between all of you. I think that's really reassuring. I go home and I feel responsibility for, just as you probably do in your role, right? And so that is where my the heaviness for me is coming in. Definitely not that I doubt that it's working and that y'all are doing an incredible job. I think this is the place for me where it's the heaviest. So I really appreciate your additional context, BC.
Absolutely.
Thank you. And my last question, I promise, is definitely for Hugo. Hugo, I think it's my understanding that there is a policing legislation on the governor's desk right now. I think SB 19 that had some sort of dispatching standards on training. Are you familiar with this? Is this something you can share with us?
Yes,
Thank you,
council members. There is, I'm not sure where it is right now, if the governor's signing it or not, but what it is, it's trying to restructure the law enforcement academy. And MERV has been part of the conversations that the state has been having. They've had, I think, 3 Zoom sessions in the last 6 months to get input. And I think the positive aspects of it as far as dispatch goes is that if it's signed, we'll get some representation on the Law Enforcement Academy Board, where we haven't before. And the standards there are law enforcement standards that are set by law enforcement agencies to dispatch agencies. And there's always been a slight disconnect there. And in the past, there hasn't been a lot of good back and forth communications between the 911 directors and the Law Enforcement Academy. So I'm very positive for this, that if it is, that at least we'll get a voice on that board and hopefully change some things to better the dispatcher training.
That's great to hear. Thank you so much. Thanks, Mayor.
Thank you. Any comments from members of the public? Okay, well, thank you very much for the presentation, Hugo and Wendy and all those involved. We appreciate this, as well as our members of the fire department and police department and everyone of our public safety officials for the collaboration that they go through. Okay, so we're going to go ahead and talk.
Mr. Mayor?
Yes.
If I can just add, if I just add one thing, that MERVDA welcomes Mayor, the council, to come and do what we call a sit-along. It's typical to a ride-along with law enforcement, and you can sit along with us 4 hours, 8 hours, as much as you want, and you can actually hear the dispatch coming in, and odds are that there will be a behavioral health call come in while you're there. So we welcome you. Just contact my office, let me know, and we'll set up for you. Thank you.
Thank you very much, Hugo. Okay, next item is going to be item 3.2, the GEO Bond Quarterly Update. And it looks like David Cedillo from Public Works is going to be making that presentation. Pinch hitting for Kyle Aaron.
Good afternoon, Mayor and Council. David Cedillo, Public Works Director, and I will be providing the 2018 Go Bond project update for you this afternoon. First project that we have is East Mesa Public Rec Complex. We're about a third of the way, or 30%, through the ARPA funding. We do have an estimated completion date of about mid-August. This is due to the delivery and installation of the sod for the park, softball, baseball fields, and the multi-use fields. As you can see, at this point in time, we are complete with underground utilities, earthwork, and the pickleball courts. At this time, the contractor is also about 90% through with the site work, the flat work, and the restroom building that you see there just adjacent to the pickleball courts. They are still working on the irrigation systems for that landscaping, which includes the sod. Our next project is the new Animal Service Center project, which does include the Rinconada Dog Park. And as you previously heard, basically the announcement under Pets of the Week, the park will be open tomorrow morning. Both the building and the park are at substantial completion. The contractor is working on some punch list items for both those sites. At this point in time, we also have El Paso Electric, who's scheduled to have the permanent power installed for both the building and the restroom later next month, April. At this time, like I mentioned, the building is complete. We do have a temporary certificate of occupancy for both the building and the dog park. At this point in time, the contractor is waiting on the kennels for delivery. Once those come in, they'll be installed. At our last update in December, we did mention that those were estimated to be delivered sometime around March, to be installed by April. At this point in time, we do have a delivery delay. We are looking at possibly May for delivery and installation. However, the contractor will be ready to install those once they do come in. The last project that we have here is just an update from our previous update in December. Again, the contractor did receive and install the remaining benches, the waste stations, and baskets on the trails. This project is complete, and staff is currently working on the closeout documents for this project. As you are all very familiar with, here's the project schedule. To note, there's a lot of projects that have been closed out. We do have the East Mesa Public Rec Complex that is being extended past December, but again, utilizing those ARPA funds. And at this point in time, both myself and Mr. Tony Trevino are available for any questions that council may have.
Councilor Bencomo?
Thank you. Thank you, David. Just one question on the Go Bond trails, and I know the answer. However, I wanted to bring up the issue of pedestrian safety crossing some of those roads, and really wondered if that is something we can potentially work on figuring out the costs so that we can put it in a budget, so that we can go out for grants, something, because I love these trails. I think they're incredible. I walk them often, and I see people, especially now that the weather is really nice, people are out there all the time. And crossing places, at least in my neighborhood, like Hoagland and McClure, it's all sketch. And so I'm just really wondering how we can put that in motion.
Thank you for the question. Mayor, Councilor Bencomo, so there's going to be a couple of things that we can do. If you recall earlier, there was a work session on pedestrian safety. That could be another mechanism to utilize to take a look at some of these intersections. We can look at what the effects are, I guess, after the installation based on what has occurred thus far, and then make an assessment from there. If there's something that we can address immediately in-house, that is something that we can work towards doing.
Okay, thank you. EFO, oh no, EFO's gone. Everybody, EFO left.
He's allowed to leave.
I'm pretty sure that we have a Connie and Sonia here who will definitely make sure that that he hears that again.
Yes, I want to put this on a list for pedestrian safety priority to look at what the cost of something like adding safety walk, I don't know, what safety mechanisms we would add in these sort of big crossing places. But please pass that along. Thank you, David. That's my only question.
You're welcome.
Any other questions from council? Members of the public have any comments? Okay, David, thanks.
Thank you.
Okay, next item, 3.3, the Sustainability Quarterly Update. Lisa LaRocque from Sustainability will be providing that update. How's the coffee, Ifo? Is it doing okay? Okay, good.
Ready? Okay. You guys are taking breaks. And good afternoon, Mayor, Council, City Manager, and staff, and anyone else who's out there listening. My name is Lisa LaRocque. I'm the Sustainability Officer for the City of Las Cruces. I'm here for a quarterly report, and this one is about solar energy, renewable energy. It is about the past, present, and future, and it's also about the municipal solar projects, the business and residents efforts, the community solar future, and El Paso Electric, all in a short presentation. So before I begin, I want to explain what net solar metering is, because there's sometimes confusion. Up until 2021, the New Mexico law said that you can only add solar onto a building or infrastructure, and it could only feed up to 120% of your annual need. And it is also connected to the grid. So what happens is that the solar energy hits the panel, it creates energy that can feed your building, or if there's an excess of energy, it can go back to the grid, or else if you need more energy at night, it would come back to your building. So it's a self-contained system that is connected to the grid that supplies some or possibly all your energy that you need if you have an excess that you put into credit on the grid. So the pros of this system are that your bills are reduced in cost because you're generating your own energy, your own electricity. The money that you save can be used to pay off a loan instead of going to the utility to pay them. You're more energy independent, and that is really important because if there's any, because in time, if you have batteries or anything like that, you will be able to take care of more of your needs. And if you do generate excess energy, you can sell it back. The cons of this system are that you still must pay off your loan unless you're independently wealthy. It takes about 7 to 10 years to pay off a loan for a residential house. That depends on the size of the house and how energy efficient you are. And because you're tied to the grid, if you don't have battery storage and there's a blackout, you're cut off from energy. And if you do sell energy back because you've generated more, the price for the purchase is low. But the good thing about it is that in time, you will own your own system. You will not pay anything for electricity because you're generating it yourself. And you will be ready for new technologies that come on board. And so as I continue on with the other options of the renewable energy, this is the one that is, if possible, is the best option to choose. So now I'm going to show you all of the solar projects that we've done. This is the early ones that we started with in 2011. Those were ERA money, so the very beginnings of the last big batch of money that came from the federal sources. Then we had the Hold Harmless HHGRT money, and we got $10 million to do projects. We did all of the projects here except for the East Mesa Water Reclamation Plant facility. They did their own project. We used the HHGRT money for the balance. All three projects down at the bottom, the Munson Sage and Public Safety Complex, generate as much energy as they need. It's called net zero. We're still doing projects. You just saw the Animal Service Center, Police Department was in 2020, and Fire Station 3. Those are still monies from the HHGRT. And now we're moving on to the competitive pool. Another strategy that we moved into was to have purchase power agreements. And what we do with that is we have a third party that owns the solar, maintains the solar, and we buy energy from them for a reduced amount. So we continue to save money, and in our agreement, after 6 years, up to 25, which is the life of a solar facility in most instances, we could buy it back at a reduced rate. So it's something to think for in the future where, again, we'll have our energy independence. So Well 63 and the West Mesa treatment plant are in the West Mesa, and South Fork is at the dam. Here's another set. All of the ones on the top are in the northern part of the East Mesa. Well 71's at Byrne Lake, airport and fire station, you know where that is. So what you have seen here is a pattern of big steps. We started out slow. We were able to get our feet wet with solar projects. Then we got the HHGRT money, and we took another step. And then we went to the power purchase agreement, and we took another step. In addition, Las Cruces Utilities did a really innovative thing with cogeneration. What they were able to do is capture the methane waste gas from the wastewater treatment plant, combine it with natural gas, and they can generate energy to fuel their wastewater treatment plant. In 2018, the council adopted a resolution that said that we should reach 25% of our electric needs by our own renewable energy generation by 2022, and we have. In fact, we're at 28% of our municipal energy is generated from renewable energy. When we made that resolution, I thought, oh my God, that's just a fake promise. So I'm very happy that we did that. And so over this period of time, we've saved $2.9 million since 2011 from solar generation from the city. Our bill is annually a little under $4 million. So with this solar, we have gotten 75% of a year for free. So that's great. And we've done a lot of clean energy, and that's even better. So we're not the only ones that that have used solar energy. There are many businesses and homes that have adopted that. And you'll see from this pattern that there's a lot of influence by your neighbor. The adoption rates always seem to happen in clusters. And that's a great thing to see how popular it has become. And yeah, so what that shows you is over that period of time, how rapidly we've been able to increase the amount of solar energy within the New Mexico service territory in general. I showed you the city. This is the data for the whole New Mexico territory for EPE. So it's Doña Ana County and a corner of Otero. There are 6,700 residents and businesses that have added solar in the past 10 years, and they've contributed 4% of the solar energy in EPE's New Mexico territory since 2021. So, lesson 2, community solar. It's a whole different model. What you do in 2021, the New Mexico adopted the Community Solar Act. And what that means is that we gave permission to small businesses to, or not small, to businesses to create large solar installations, arrays. And with that, those are out in a wide open space. And what happens is that they look for subscribers who say that, yes, I wish that I had solar energy, and if I subscribe to this community solar, my price of electricity will be lower than what I'm paying for utility. And that is one of the first pros of that. The second is you don't have any upfront costs to having solar. It's there as soon as you start subscribing. And that's particularly good for renters, condo owners, or people who move around a lot, even in EPE's territory, because you can move your subscription to different places. And like the metered example, the community solar project can sell its energy back to El Paso Electric, and the subscribers would get the credit. The difference in this is that the community solar energy is going to go directly to the grid. The grid doesn't know. It's a motherless child. It has no idea where its electrons came from. So it can be from solar, it can be from fossil fuels. We know in our hearts where that's from, but and so it just fills the grid with clean energy, and the subscribers get a credit on their bill. We're not delivering it to their house. They're not using it. It's just knowing that they're getting clean energy, cheaper energy, and promoting the whole concept of solar, especially if they don't have it available. The cons of this is that not all subscriptions are the same. These are businesses, so they can make their own set of rules with lots of guidelines, of course, as to whether or not they're going to pay you by kilowatt hour. So every hour that you use electricity, or by, a couple panels that now belong to you, or however they want to frame it. And so it requires that the buyer beware. And the Community Solar Act did have a lot of community protection elements in it. So we are confident that that will help the buyer beware. You never own your own system, as I said before, so you're always going to pay something for your electricity as opposed to eventually owning it. So that's a difference. And there's a lot of space that is required for a big community project. And that can be space that's not used for something else. So it's worth considering. And the last thing is that, like the net metering, the purchase price for returned electricity that you don't use is not very high. So I was talking to you about the proposed community solar projects that are out there. At most, we're going to have in the whole state, we're going to have 200 megawatts of community solar from New Mexico, in the 3 New Mexico investment-owned utilities. So PNM, EPE, and Excel are going to can at most have 200 megawatts of solar community solar in their regions. And the El Paso territory is about 30 megawatts. And the the maximum size you can have for any community solar project is 5 megawatts. So I'm glad to see no one's eyes are rolling with megawatt, but it's like equivalent to 5,000 houses. Okay, so if we can simplify our units in that sense. If you were just doing houses, that's how many moderate-sized homes you could have. So the city, the Las Cruces utility, is partnering with an organization, Amoresco, who did our purchase power agreements and submitted an application for a community solar project. We don't know if we're going to get it, but we're supposed to find out by the end of the month. I think it's a great project, but we'll see how the PRC feels. It's at the old Foothills landfill, which is on Sonoma, and so it's a brownfield, so that property couldn't really be used for a lot of different things. So that's a point in our favor, literally and figuratively. You get credit for that on your proposal. And if you think about 5 megawatts, even though I talked about 5,000 houses, that also is equivalent about 2% of the citywide electricity used. So it's great, it's not a lot. So it's not like we've upseated El Paso Electric from doing that, because there's at most 6 for the whole territory. And then there's also a usual condition that's in the Community Solar Act that says 30% of the project has to go to be dedicated or subscribed by low and moderate income. But in this project that LCU and Amoresco are doing, we have targeted 50% of the community. So to be able to receive the subscriptions. And our goal is to reduce the electricity costs by 30%, which is a really significant drop. And the balance of that is not subscribed can go to small businesses of any size. So we've just seen lots of great examples of how the city, its residents, its businesses have embraced renewable energy. There's also El Paso Electric and other utilities are required to have a percentage of renewable energy in their portfolio. Without that requirement, we would say that all of the electricity that we have, because it's connected to the grid, would be carbon laden energy. It would make our carbon footprint as dirty as possible. But the New Mexico Energy Transition Act that was passed in 2021 put a really set of ambitious goals forward to the investment-owned utilities and to the co-ops. And what they said is that by 2020, we were supposed to have, each utility was supposed to have 20% of their portfolio was supposed to be renewable energy. And so El Paso Electric's had some trouble with it, but they anticipate that they will reach 20% by 2024. And so if you look at this pie graph on the right, it shows that we're helping El Paso Electric, that all the residents and businesses in Las Cruces and the New Mexico territory are contributing 4% to that 20% pie. The community solar that we're anticipating that are coming, where there'll be 6 different projects, will be contributing 2%, and the city contributes 1%. So that leaves about 13% that El Paso Electric is responsible for putting forward. By 2025, El Paso Electric's going to have to bump it up as will P&M and Excel, to 40%. And so we will expect our carbon footprint to drop by that same amount. By 2030, it'll be 50%. And by 2040, it will be 80%. And then the balance at 2045 is required just to have decarbonized sources, which most likely will be the nuclear power plant that they've been using in Tucson, Palo Verde. So we are headed towards a really positive future, and this pathway might even accelerate because people want to, and because El Paso Electric has set more ambitious goals, although I'd be happy with these. And so with that, I stand for questions or comments.
Councilman Como? Yeah.
It's true, I have a question. Just one, Lisa. Thank you for this really thorough presentation. On the proposed plan, I'm curious about...
This one?
Yes. Yep. So right here, what you have in blue, that's the entire property, right? Is there, for this proposed plan, like how much property do you need for this project?
Mayor, Councilor Bencomo, that's about 35 acres.
That you have highlighted here?
Yes.
And that you would need for the community solar?
Yes.
Project. Okay. I'm really bad at, people can say it's like 20 acres. I have no context to that. So I will maybe just talk with you offline about, it's a lot. I imagine that's a pretty good chunk.
Mayor, Councilor Bencomo, I follow the same challenges that you do.
Okay. Maybe the mayor can paint us a picture of what 32 acres looks like.
Well, 32 acres, so it's about 1/3, the land that we acquired from Albuquerque, the 110 acres, so it's about 1/3 of the size.
Okay. That's actually helpful.
I don't know the council.
It's not even how many football fields is it?
43,000 square feet, though. Right?
City managers in our camp, too.
Okay. A third. That makes sense to me. I appreciate it. Thank you.
We'll try to figure
Mayor
it
Pro
out.
Tem and then Councilor Graham.
Thank you, Lisa. Always really appreciate you just have a way of speaking high-level stuff really, concretely, so thank you for that. What is in the plans in the works to get more like third-party facilities? Do you have that third-party with Johnson Controls, that third-party, solar installation and some of these other places that we're in need of? Do you have that for the next year, couple of years? What?
Mayor Pro Tem Gandra, I didn't want to do a spoiler alert here, but
Yay, do spoiler alert, sorry.
there is an amazing new program called Direct Pay that allows nonprofits like this city to get an equivalent to the discount that businesses own. So they would get a 30% not a tax credit, they would get a 30% deduction for solar. If they dedicated the solar to 50% low and moderate income, they would get a 50% deduction. So there are many ways that we can do it ourselves, and getting a third party is great, but even those third parties, that they're energy service companies like Johnson Control or Amoresco, they're moving towards saying, hey, I'll build it for you, I'll be your contractor, and I'll maintain it for you and make sure it's running perfectly for the 25 years, but you'll own it. That is the best option. Now, having said that, in all honesty, I have not been planning anything specifically, so that's my other part of my spoiler alert, for a large-scale project. I've been impressed with the fact that since I started, that these projects right here, those projects right there are projects that have been GeoBond projects, and they are getting their own solar. The rest of the staff is embracing it. They're doing it. I'm on to other things. So keep encouraging them. But I'm still here to help, but that we're working on some new projects that take advantage of the the Inflation Reduction Act funds that are out there. So we haven't been working on solar. It's loved and embraced now as a mainstream thing, and I'm more of
You're a cheerleader.
I'm an innovator. I like to do things that are new and troublesome.
Sure. So, Ivo, can you answer that question? It's sort of what plans do we have to scale out more solar installation? Any new builds that we might be considering, or buildings that don't have solar currently but have a high energy or electricity bill?
Can I, Mayor and Mayor Pro Tem, City Manager, I forgot about my buddy from Las Cruces Utilities.
Yes, I see.
That's what they're doing. That's what they're diversifying their energy stream,
Yes.
and that's the best source for you. Yeah. But
Yes.
I'm sorry, City Manager, if you'd like to continue.
Mayor Pro Tem, Council Mayor Pro Tem, I don't know if we have like a plan in place that's going to phase transition to solar, but certainly it's something that we look at with every new build. So anytime we're going to build, we're going to look if it's a feasible option. And Lisa will tell you, sometimes it's not, right? And especially with community solar coming on board, it's really more feasible to look into something like that now, as opposed to putting them on the roof or taking up valuable space. So with community solar, you're allowed to put it on the grid through land and areas that are not so cumbersome or so valuable. But as far as a plan, we don't have a plan to go and retro buildings. But I think there's a more efficient way to do this, as Lisa's been preaching with community solar.
Okay. I think we should have a plan. Probably talk about what that might look like specific to community solar. I think those are some very interesting opportunities and things that we should forecast. I mean, potentially 4 of us may not be here next year. And so I would really like to see a plan between now and November that solidifies, like, not just this, oh yeah, it's embraced, but that it's what we're going to be looking at from, in the next 3 to 5 years.
Mayor Pro Tem Gondra, I didn't mean to sound flippant with that at all. I just meant that other people are looking into it too, so it isn't something that I have taken the lead on. But I do know that the community solar that was talked about is something that's going to be tested out right now. They're not going to be opening it up again for another set of bids till 2025.
Yeah.
But I know that LCU is looking at how they can be poised to take the next iteration on, which would be another sizable chunk to the city. And every time that if we're an anchor tenant for that, that's 10% more that we've bitten off for what we do in terms of associating with renewable energy.
Sure. Okay, that's good. And then eventually, when will we be able to hear EFO, the energy plan, the diversion or the conversion to energy through utilities? Is that something that, since you brought it up and...
Yeah, we have the energy transition plan in the works. I mean, we can have Adrian maybe suggest some specific dates.
Thank you, Mayor. Mayor Pro Tem Adrian Whitmer, Utility Director. Right now, we're finalizing the RFP that we're going to be taking through SAC for the Energy Transition Plan. We've been working closely with Lisa. She gave us a lot of really good comments, and so staff have been trying to work that out, whether it's going to be one phase or two phases. And so we hope to have that RFP out here within the next couple of months, at least to SAC, so that we can go through, so that we can start making, get that taken care of, so that utilities knows which direction we want to go forward in. And so we're leaving it open for any and all types of energy. As you know, as a utility, it's our responsibility to make sure that power is provided no matter what. Mm-hmm. So like if the grid goes down, the wastewater plants, the lift stations, the pumps, and the boosters cannot. They must always have the ability to turn on and provide, because we don't want wastewater flowing out or having spills or people being without water. So we got to be open to any and all types of energy.
Absolutely, I agree, Adrian. Okay, look forward to hearing more about this.
Yeah, you know, we're really excited about it. So.
Yeah, I'm so glad. Good, good, good. Okay, perfect.
Thank you.
Thank you. Thank you. Those are all my questions, Mayor. Thank you.
Thank you, Mayor Pro Tem. Councilor Graham, ironically, the football field is approximately 1 acre. So it'd be 30 football fields. Yeah.
Thank you, Mayor. Becky Graham, City Council District 3. For the record, how come we're the only ones who don't have to do that? Like, our voices. Really, it's just so weird. I always feel so bad that everyone has to do that and multiple times. So I'm gonna, in solidarity, I'm gonna announce myself every single time. Not a question, Lisa, just more of a comment, that I was so glad to hear that we are going above the minimum for low and moderate income households that will benefit from community solar, because I bet if your really cool tricked out map, if we overlaid the MRA designations, I bet some of those gaps in residential solar would line up pretty neatly. And I think my own home is a great example that it can be really difficult to retrofit. My house was built in 1950. All of our HVAC is still up on the roof, and we got that's the face they made when I got a solar consult. They're like, oh, you know, and they're trying to be really optimistic and positive. As a two-person household, we could probably swing having panels that would supply our needs in the backyard, but not everyone has that kind of space. Also, you know, as you pointed out, and the MRA, I love the confluence of everything that we do. The MRA report pointed out that homeownership is significantly lower in the MRA designated districts. So the idea that renters can also benefit. So I just wanted to point out that I'm really happy that we're going above what we need to and keeping community solar when we get there more accessible. Becky Graham signing off.
Okay, so I've got a question on purchase power agreements. So were you telling me, I can't remember, but when I brought it up a couple years ago, is the legislation kind of puts a minimum size on the purchase power agreements that we can enter into with other companies or developers?
Mayor, the limit for a purchase power agreement is not for the utility, for us, has to be net metered. It has to be connected to a facility. So the maximum you can put towards the maximum size of a solar installation that is leased by purchase from your third party can only be 120% of the total amount of energy that your facility uses. So that's the cap of it. You can't go over 120% of what you annually use.
Okay, so I guess I'm not tracking that. So just for Councilor Graham, if she's not aware of what a purchase power agreement is. Oh, you do? Okay. That's no football field. So this was something that was, in fact, the city had done a couple in the past, and then, or was looking to do. And so, for example, let's just say we spend $100,000 a month on electricity here. And since the city doesn't file tax returns, we can't take advantage of the credit that others can. So some of it is 30%. So a developer or investor will come and say, listen, if you let me own it with them, they can take advantage of that 30%. So by us working with them, it's going to reduce our energy costs, let's say $50,000 a month. So that's a lot of savings. And so our energy costs are now $50,000, and we had been budgeting $100,000, so we've got $50,000 left over. That's what we pay the developer, because let's say their debt service is $35,000 a month. So we still have $15,000 left over that we actually ended up doing better. In addition to utilizing solar. So I thought that in the past that the legislature or somehow the utility companies had gotten the legislature to put a cap or minimum size of purchase power agreements. And basically saying it's got to be very large for this to happen. There's not that many large buildings in the state. We may have a few. Albuquerque obviously has them, and the rest of the state, probably not. So you're telling me that the 120% is applicable to this?
Mayor, from my understanding, the only way that you can purchase power is if it's for your facility, which is always capped at 120%. I'm trying to, and I agree with you, Mayor, that it was always better. It's for large-scale projects. It was historically always better to have a third party be able to a profit business, build the solar, because they do get the 30% tax credit. They get an accelerated depreciation and some other incentives that allowed it to be the better option. But now, just this year, it's not, because we get direct pay, which is the same benefits I just described for us that a business gets. But the only other description that I think I could be confused on what you're saying, but there are energy service companies like Johnson Control Company who did retrofits here. They did retrofits in Las Cruces Utilities, and they could have also put on solar. Amoresco had an energy service contract, and they put on solar at NMSU. So it can be a mix of energy, and in that case, sky's the limit how big you want that to go in. But in terms of a purchase power agreement in solar, I guess I'd look at them as unique services. The energy service contract that you described is one where a company assesses all the ways that energy could be more efficient or solar could be put in. They put it in, you get a loan, and that savings that you have is so great that you can pay off that loan for many, many years. And that has no cap. if it's just solar attached to a building, it does, or a facility, it does.
How about if we do this, if the consensus of council, and I know I just hit you cold here, maybe you can come back on another time and bring us some more information to see if there were some changes to the legislation. What you were talking, and this took place before Councilor Graham was here, Johnson Controls, what they did is they replaced our old, outdated, whether it's air conditioners, boilers, whatever, and put new Energy Star appliances. And so, but purchase power agreements were specifically for solar, and that's it. It's they can take advantage of the discounts and the savings that we have, that we enter into a contract to pay them. And so, if you can maybe,
Sure,
if that's
I'll
a
look into it.
consensus to look at, because the reason where this came up is because people were having a hard time, especially governments, just to come around, throw an extra couple $1 million for solar. But when you do it this way, now you have investors who want to participate. It makes it more advantageous for them. They benefit, the city benefits, the taxpayers benefit. But I thought there was a minimum size, not a maximum, but a minimum size, and it was pretty large, and which I thought that was kind of unfair. Here a lot of people were looking forward to that, and then somehow the legislature passed it so that they had to be a certain size or larger, which the university I'm sure has some,
Yeah.
but we don't have too many big buildings. This one, convention center, maybe the aquatic center, those might be about the only that. All the rest are too small, and that's what I thought was the case. So if that's a consensus of council for you to maybe bring that back at another
Sure.
time and work with the management team as to when you're ready, that'd be great.
Yeah, Mayor, I'll look into it. Thank you.
Okay, any other comments about members of the public? Okay, well, I think this concludes our work session, so thank you for that presentation, Lisa.
Thank you.
And if there's nothing further, entertain a motion to adjourn.
Move to adjourn.
Second.
Motion made by Councilor Bencomo, second by Mayor Pro Tem Gondara. Christine?
This is on the motion to adjourn the work session. Councilor Abeyta is absent. Councilor Graham?
Yes.
Councilor Bencomo?
Yes.
Councilor Cran is absent. Councilor Flores is absent. Councilor Gondara?
Yes.
And Mayor?
Yes. Okay, we're adjourned. It's 3:27 p.m. Thank you. Okay. All right, this is the agenda setting meeting for our April 3rd, 2023 City Council meeting. Number 1, non-consent.
1 non-consent.
Number 2, non-consent.
2 non-consent.
Number 3, non-consent.
3 non-consent.
And number 4, non-consent.
4 non-consent.